Let's take a moment to face some hard facts. Billions still live without basic water, sanitation and hygiene services, putting lives, health and futures at risk. As of 2023, 2.2 billion people lack safely managed drinking water, including 115 million who rely on unsafe surface water. Contaminated water is widespread. At least 2 billion people drink water tainted with feces, contributing to deadly infections, including those causing 1 million unclean birth-related deaths each year. Many people, it's around 200 million globally, still spend over 30 minutes per trip collecting water, mainly women and girls, further limiting educational and income opportunities. 3.5 billion lack access to safe sanitation. More than 400 million still practice open defecation. Around 2 billion people don't even have basic hygiene facilities. These gaps are deadly. Unsafe water, poor sanitation and lack of hygiene cause the death of about 1,000 children under the age of 5 every day. In healthcare settings, more than 700 million people still lack access to water, sanitation, hygiene services, endangering patients and health workers alike. Fragile contexts are especially vulnerable. People living in conflict or crisis-affected areas are twice as likely to lack safe water and hygiene, and 20 times more likely for under 5s to die from water, sanitation, hygiene-related diseases than from violence. The COVID-19 pandemic made the crisis even worse. Remember how often we were told to wash your hands. But what if you didn't have clean water or soap? That was, and still is, a reality of millions of people. Lack of WASH, this is an acronym which stands for Water, Sanitation, Hygiene, has major economic impacts, costing countries up to 5% of their GDP. On the other hand, investing in these services brings clear returns. Every $1 invested in rural drinking water returns up to 7 in benefits through saved healthcare costs and improved productivity. Yet, at current progress rates, the world will fall far short of SDG 6 by 2030. 3 billion people will still lack safe toilets, 2 billion will lack safe water, and 1.4 billion will be without basic hygiene. There have been some signs of progress. Between 2015 and 2022, the proportion of the world's population with access to safely managed drinking water increased from 69 to 73%. But this pace is far too slow. None of the SDG 6 targets are currently on track to be met, and meeting them won't be cheap. Estimates suggest that achieving SDG 6 will require over $1 trillion per year. Yes, $1 trillion, and yes, every year. Looking ahead, the challenge is only expected to grow. By 2050, as many as 2.4 billion people living in cities could face water shortages, more than double the number in 2016. Global water demand is projected to rise by 20 to 30% by mid-century. Just producing one person's daily food requires 2,000 to 5,000 liters of water, and food demand is expected to increase by 50% by 2050. Hence, the world needs to move faster, much faster. Right now, we would need to go 6 times faster on providing safe drinking water, 5 times faster on improving sanitation, and 3 times faster on hygiene. But what can we do as ordinary citizens to help achieve this goal? Actually, everyone can help. Bring clean water and toilets to all by doing simple things in everyday life. You can save water by turning off the tap when brushing your teeth, fixing leaks and using water-saving devices at home. Washing your hands with soap and keeping clean helps stop the spread of disease. Don't pour harmful things like oil or medicine down the drain, as they can pollute water. Respect and take care of public toilets and sinks, and speak up for clean water and toilets in school and hospitals. You can also tell others why water and hygiene are important, join cleanup events or support groups that build toilets and provide clean water. Finally, ask your leaders to support better water and sanitation services for everyone. Small actions from many people can help make big changes. And while these steps may sound obvious, it's often the obvious things that truly make a difference. Clean water and sanitation is not just a health issue. It's a fairness issue, a dignity issue, and a survival issue. Thank you very much.